guys, this is Dr. Hub. Today we look at the structures. The structures which open. So it opens into meatus. So opens into the meatus, and this will be of the nose, into the meatus of the nose. So first there is a inferior meatus. So in terms of the inferior meatus, it includes, there's a NLD, there's a nasolacrimal duct, and this is guarded by the valve of Hasner. Next is the middle meatus. So in terms of the middle meatus, it includes, there is a frontal sinus, then comes the maxillary sinus, next is the anterior ethmoidal sinus, AE sinus. So it's basically FMA, that is the frontomaxillary anterior ethmoidal sinus. So all these together they form the osteomeatal complex. So it forms the osteomeatal complex, or the picadal circle, Now let's go further. We look at the superior meatus. So what is present in the superior meatus? So in terms of the superior meatus, it is the posterior ethmoidal sinus which opens. It is a posterior ethmoidal sinus. So this opens. Next is the sphenoethmoidal. The sphenoethmoidal, what opens is the sphenoethmoidal recess. There is a sphenoethmoidal recess. So what opens here is a sphenoidal sinus. Now let's draw a rough diagram to understand the structures where it is present. So this will be the nose. So let's draw the turbinates and the concha. So here, this will be the middle ethmoidal cells. These are nothing but the middle ethmoidal cells. Next, there is opening of the frontal sinus and the anterior ethmoidal cells. So here, there is opening. So opening of what? Opening of the frontal sinus and the anterior ethmoidal sinus and the anterior ethmoidal sinus. Next comes in below that, there is the hiatus semilunaris. This will be the hiatus semilunaris. And next, right in between here, there is the opening of maxillary sinus into the infundibulum. There is opening of the maxillary sinus. So this opens into the infundibulum. Then comes the posterior cells into the superior meatus. So there is the posterior ethmoidal cells, and this will be present into the superior meatus. Then comes the sphenoidal sinus into the sphenoethmoidal recess. This is the sphenoidal sinus. This is into the sphenoethmoidal recess. Next, the below, there is going to be the nasolacrimal duct. So here, there is presence of the NLD, nasolacrimal duct. So this was a rough diagram depicting the paranasal sinuses. To learn and grow daily like this, please do subscribe.